Assalamu alaikum. Hello dear students. Today we will discuss very important topic, and that is herpes viruses. So first of all, herpes viruses belong to the family Herpes viridae. Actually, the herpes viruses derived their name from Greek word herpene, which means to creep. What does it mean? It means that when any type of infection is caused by herpes viruses, these infections spread from one body part to the other body part. Therefore, these viruses are named as herpene. Herpene means to creep. Now, the question arises that how many types of herpes viruses? There are more than 100 different types of herpes viruses that have been isolated from different hosts, for example, from mammals, from birds, fish, reptiles, amphibians, and mollusks. But the very important viruses that are medically important, there are about eight of these viruses are human viruses. Now, these viruses actually they cause many diseases such as, for example, cold sore, genital herpes, chickenpox, shingle, etc. Now, if you look at the virion of the viruses, the herpes viruses are enveloped viruses. You should note that these are enveloped viruses, and actually these enveloped viruses they have icosahedral capsid. The capsid is icosahedral, and the diameter is about 120 to 200 nanometer, and the genome is actually double-stranded linear DNA. Genome is actually double-stranded linear DNA genome. And now if we talk about these, there are 8 herpes viruses that known in the human, and most adults in the world are persistently infected with most of them. Now, what kind of viruses? What are the name of these? The first is herpes simplex virus, first and second, Epstein-Barr virus, human cytomegalovirus, human herpes virus 6, Kaposi sarcoma associated herpes virus, and human herpes virus 7. Now we discuss one by one. Human simple virus first and second. What these viruses do? Initially, these viruses infect the epithelial cell of the oral cavity or genital mucosa, the skin or the cornea. You know that reproductive systems, the skin and the oral cavity and the eye of the cornea have mucosal lining. Now, herpes simplex virus first and second, they initially infect these epithelial cells. Now, when these viruses infect this area, the virus may enter the neuron and may transmit to their nuclei, where they establish latent infections. You should note that these viruses cause latent infection. How they cause latent infection? First, they affect the mucosal linings and they enter the neuron, enter the nuclei of the neuron, and may establish the latent infection. Latent infection are those infections when the virus get opportunity. For example, when the body of the immunity system is disrupted, then these viruses may reactivate it and cause the infection. Now, human simplex virus first, they commonly infect the lips or the nose between the age of 6 or 18 months. They infect the children. A latent infection may be reactivated. For example, if the host immune system is immunocompromised due to disease, they reactivate it. Now what it do? The reactivation results in the production of the virion, which is in about 20 to 40% of the cases are transported within the neuron to the initial site of infections. It means that when they are reactivated, they again attack the initial site of infection. What they do, where they cause productive infection in the epithelial cell resulting in cold sores. Occasionally, there may be serious complications such as encephalitis, especially in the immunocompromised host. Now, human simplex virus 2, actually, it is the causative agent of genital herpes. What does genital herpes mean? Actually, which is a sexually transmitted disease. In newborn, often affected are those in the face or the trunk, and these are the area most commonly affected in zoster, mean shingles, when a latent infection is reactivated. Now, a notable characteristic of herpes virus is that once they are infected a host, they often remain a persistent infection for the lifetime of the host. These infections are most often latent infection, which can be reactivated from time to time, especially if the host become immunocompromised. Both primary and reactivated herpes infection can be either symptomatic or can result in a disease of varying severity. The outcome depends on the interplay between the particular virus and its host, and especially on the immune status of the host. If a person having strong immunity system, there will be no reactive infections. Epstein-Barr virus. Epstein-Barr virus is transmitted in saliva. Epithelial cells are infected first, and then infection spread to B cell, which are the main host cell type for this virus. More than 90% of the people become infected with Epstein-Barr virus, usually during the first year of life, when infection results in few or no symptoms. In developed countries, some individuals do not become infected until adolescent or adulthood. A proportion of these individuals develop infectious mononucleosis. What does it mean? It is a glandular fever, commonly called the kissing disease by doctors. EBV is also associated with a number of tumors in men. Human cytomegalovirus symptoms are either absent or mild, but in pregnant women, however, the virus can infect the placenta and in the fetus, for whom the consequences may be serious. In the US, about 1% of babies are born infected with virus. Human cytomegalovirus can also cause severe disease, pneumocystis, hepatitis, and the immunocompromised patient, such as those with AIDS. Those have received treatment for cancers, and those who are immunosuppressed because they have received an organ transplant. Human herpes virus 6. There are two types of human herpes 6 viruses known as HSV-6A and HSV-6B. Infection of a child with a latter can cause a fever and the sudden appearance of rash known as exanthum sublatum. And the last one is Kaposi sarcoma associated virus. Actually, Kaposi sarcoma associated virus, herpes viruses, was discovered in 1994, and it is named after the tumor with which the virus is associated.